Texas-born pediatrician Professor Dr. Christine Loock once wanted to be a small-town doctor who made house calls in a pickup truck in a native community in South Dakota, USA. Her original plan has changed dramatically. However, she is still a doctor, currently an associate professor in pediatrics at UBC, a medical consultant to the BC provincial government, and an expert in fetal alcohol spectrum disorder. It is my pleasure to welcome Dr. Christine Loock to Studio 4 to tell us more.
Good morning.
Interesting beginnings and interesting dreams for you. Why Dakota? Why a country doctor?
Well, my mom was a nurse. She trained in Manitoba, and she went off to explore, and so she left St. Boniface to the Black Hills General Hospital, met the handsome lifeguard, my dad, and we ended up in Texas. My pediatrician was from McGill. My mother worked for him, and I said I wanted to be a nurse, and she said, "Oh no, dear, you'll never follow orders." But I actually know now that I take all my orders from nurses. So I think I had really strong beginnings with an understanding about the importance of public health and outreach.
Sure, and a feminist mother who said to you, "Dear, be a doctor. You can be a doctor."
Yeah, absolutely. And I have to give my dad some credit in that too. And so they both said school. Sports was important for me, but it was so that we got an education and we did something with our potential.
Right. Well, not only sports was important for you, you were pretty good at diving, I hear tell.
Yeah, pretty good. Pretty good.
Well, so, no, Olympic diving.
Yeah, third in the world. Yeah, third in the world at one time, and first woman on a man's team, on a university team. Now they have scholarships for women. They don't like us beating the boys.
I'm sure not. Do you still swim and dive?
One of our daughters does. She's an NC2A champion. My husband was an Olympic diver for Canada. So, yeah, it's a little bit of genetic selection.
Right,
yeah.
a lot of genetic selection. Now, over to the topic, fetal alcohol spectrum disorder. Who coined the term?
The term was coined in 1973 at the University of Washington, where I later did my residency training. It actually, FAS was first described in the 20th century in France, but most of us don't look at the French literature. But about 5 years later, the Seattle group was able to describe this. It hit the medical community, and one of our pioneering pediatricians, Kojo Asante, who's still practicing in Maple Ridge, was the first to describe the condition in Canada in about 1976.
What is it?
FASD is fetal alcohol spectrum disorder. It represents the spectrum of effects that alcohol can have if a woman drinks during pregnancy. FAS, or the full syndrome, was the original description of children who were small. They had some characteristic physical facial features, and they had brain injury. That, now we've realized in my 20 years of research, is the tip of the iceberg. The kids who we recognize, most of the kids are invisible. They have what we would say are alcohol-related brain injury or neurodevelopmental disorders, and that's been the challenge, is having people realize that it's not just a small group of kids with severe brain injury and mental handicap, but actually they're a group of kids who have learning differences, judgment, planning, and all those things are preventable.
Can you link specifics to it? Learning disabilities, obsessive compulsive disorder?
There's a wide impact that alcohol can have on a developing brain, so it really depends on timing and dose. And then there's so many important things that we've known, but now science is showing that environment matters. So we call this epigenetics. So the amount that a woman drinks, her health in pregnancy, the stress that she's experiencing around her in pregnancy, all can contribute to how high the blood alcohol is in the developing baby. But that baby also comes out into a world that is either chaotic and there's adversity, or there's nurturing. So we're looking very much at the whole package of nature and nurture now. And so there's not just one drink, one effect. We're looking at the spectrum.
Because as you know so well, I don't know about your mother, but I know my mother drank before she had me, and probably while she was having me. I know I drank. No one told us not to.
Right.
When we were pregnant.
And I
you
think
don't feel so good the first 3 months, so you don't. But then I know when my water broke, we were playing bridge. I shouldn't admit this, but I said, you know, I better have a scotch because I'm going to have to go into labor if I'm not already.
Right. Fanny, I think it's really important. It's about respect and understanding. most women, until we discovered FAS, didn't know about this, and understanding that the message means all of us. This isn't just women who have alcohol dependency. Our biggest concern actually now are young women in their childbearing years who are binge drinking. So we look at, half of Canadian women drink and half of our pregnancies are unplanned. So maybe, 1 in 4 of current pregnancies are still alcohol exposed. Now, our concern is that the damage can start before we know we're pregnant. And the concern is that it's this drinking in university, it's the drinking that is the high binging, so not the chronic daily or the one scotch. It's the getting your blood alcohol above the level you should be having for driving, so the 0.08, so 4 drinks, very damaging. So the message is, the public health message is abstinence. But the message to my kids, to kids out there, is this means you too.
Okay.
Yeah.
Now, are there women who drink sometimes to excess, not alcoholic, but socially drink, get pregnant, have a totally healthy baby with no effects?
Well, I think that the issue about effects is that not all individuals are affected in the same way, and in looking even in the research studies using sort of research animals and looking at that there may be some protective effects. We just don't know who has those protective factors. So that the best message again is that all of us are at risk. The more we drink, the higher at risk. But there is the evidence around low-level drinking, around either safety or harm. We can't tell a woman it's okay to drink 1 drink or 2 drinks. We are certainly concerned about a woman who's drinking daily, 2 or more drinks per day, or binge drinking. And somewhere in between is that gray zone where the best advice is don't drink.
Just don't drink.
Right.
Play it safe.
Right, and the turn it around is that if you have drank, stop drinking because of those things. We talked about the epigenetics, about the environment. I also think we need to recognize that there are protective things in our environment, our nutrition, that may buffer that exposure. So stop now, get help if you need help, and then look towards getting support for your child if you have concerns, if you were drinking heavily.
When a baby is born to a drinking mother, a mother who's abusing, or maybe just a mother who's binging,
right.
Can you tell immediately as a pediatrician something is wrong? Are there tests you do on the child? What?
Sometimes we can tell. And so the kids who have full fetal alcohol syndrome can be diagnosed at birth. They sometimes are very small. They're below 5.5 pounds in weight. They may be irritable, difficult to feed. They may have other birth defects like cleft lip and cleft palate or spina bifida. These things, alcohol can lower the threshold or raise your risk for some common birth defects. It interferes with nutrition like folic acid, things that we know now impact having birth defects. So we may see that. More often, it starts to emerge in the time when kids start to talk, so the toddler years, or kindergarten when they can't sit still in circle, or learning to read, or starting in grade 3, grade 4. But even sadly, kids that are transitioning into high school where it gets confusing. And so it's never, it's never too late for a diagnosis. A diagnosis has a significant benefit for the individual kid and also for their mother.
Sure. And are males more affected than females, or does it matter?
Doesn't, we don't see a selective effect.
Gender's not an issue.
It's not about gender. There are differences. We develop at different rates, and there are differences, but the susceptibility probably has more to do with, again, the dosage and the timing and the health of the mother, possibly other drugs. Sadly, as we get older and as we've had more children, the risk appears to go up as well. So our body seems to be less protected against an insult such as alcohol. Alcohol is not a food. Alcohol is a drug.
Yes, for sure. So if a woman is not just addicted to alcohol, but addicted to cocaine or heroin or pot.
Those, you can have interactive effects. They may be perhaps more severe. For me, for the most part, if I know a woman is drinking, she often is a heavy smoker. A cocaine user frequently uses alcohol. So that mixture of drugs, you have a combined picture. And the early messages were all about the illegal drugs. And we have to say, Alcohol is the hidden factor in there. Okay, a lot of the early withdrawal from drugs resolves with less effects than the longer-term effects that alcohol may have.
If a female only smokes, does that affect the fetus?
Well, early studies saying our
smokes
smoking.
tobacco.
Yeah, no, our early, that generation. We're a generation of smoking. And there we may be a little less attentive, a little more hyperactive. Maybe some learning effects from the lowering of oxygen to the fetus from smoking. So absolutely, smoking is a huge issue,
Sure.
causing prematurity and causing effect. But it's the combination of the smoking and the alcohol that appears to be especially concerning.
Okay, so bottom line, try not to.
Right.
When we come back, we'll talk about the cost to society, how you're helping fetal alcohol kids and moms who are abusing.
Absolutely.
Okay. Dr. Christine Loock, our guest, she's an associate professor at UBC in the Department of Pediatrics, and she's a pediatrician.